we need as a country to re-engineer ourselves and to really focus on preventative healthcare, not just wait for things to get to a critical stage, but to prevent them before they actually happen. This must be the focus, and this must be the base of our universal healthcare going forward. I think, Governors, you will agree with me that as a result of some of the measures that we have taken during this particular COVID pandemic, we have seen a massive decline in waterborne diseases and the problems that have affected our people in the past as a result of cholera, bilharzia, and other waterborne diseases. All these issues related to cleanliness. We have seen a huge reduction in the number of cases that are being reported in our respective hospitals as a result of the actions that we have taken on COVID. So mine is to encourage us and to say that as we move forward, some of these positive measures that we have adopted during this pandemic should become the new normal, should become the new Kenya, should become the way we move forward. And we should incorporate and build upon these as we continue, as indeed was said, to strengthen our capacities, especially in our community workers, in our health workers at the grassroots levels, to be able to help us ensure that we are able to prevent before we need to get to the cure. The other issue that I think has come out very strongly in this conference is the need for us to once again refocus on mental health care. We have seen that this is becoming an increasing problem, as I have mentioned in the past, an increasing problem in our country, amongst our people, especially our young people. There is really a need for us to refocus our efforts and redouble the work that we're doing to help and to work with the mental health of our people. And towards this end, I really want to say that it is not just the relatives or the health workers, but it is the population at large. I mean, there has been a huge impact as a result of the lockdown that we have had on our young people who have felt restrained and constrained from the liberties that they know. And this has seriously affected the health and well-being of our young people. So I think that there is need for this, and there is need for a focus on this. And towards that end, without even waiting for the national conference, I do hereby direct the Ministry of Health to begin working on an active plan that they can present to us when we have our national conference on how we are going to deal with the issue of the mental health and mental well-being of our people. I think the other issue that has strongly come out is the issue of the need for transparency, especially with regard to procurement in our country. We have focused heavily on some of the issues that have been raised with regard to procurement in KEMSAR and others, but I think this, as indeed was said by some of the speakers earlier, is not an issue that is related just to the health sector, but indeed to all government procurement. At the national level, at the county level, in the judiciary, in the National Assembly and Parliament, we need to work together because we have the laws. What we need to have are the systems. And again, towards that end, I also hereby direct that the Ministry of Health, within the next 30 days, must come up with a transparent, open method and mechanism through which all tenders and procurement done by KEMSA are available online so that we can see who has been awarded a tender, we can see what is the value of that tender, we can see what was that tender for, we can see as they proceed How was that tender evaluated? We can see how have people bid. We can see who was finally awarded. I think this level of transparency and through the use of technology will go a very long way towards ensuring that we have the confidence of our people, that those who are placed in institutions are able to manage the resources of the Kenyan taxpayer plus our development partners in an open and transparent manner. And I think this, as we start with the Ministry of Health, is something that we must move into all government departments, like I said, be they in the national government, the county government, or for that matter, in the various other arms of government. The Kenyan people have a right to know how their funds are being utilized. I think the other issue that came up, which I also just want to touch on, is the issue of preparedness. And preparedness is at all levels. I heard Governor Roba speak earlier about the fact that he was taken by surprise. Well, Governor Roba, you shouldn't be taken by surprise. Health is a devolved function as much as we partner together. You must also equally be ready, not just for COVID. You will have other issues that will be peculiar to your county, be they to do with foot and mouth, or other diseases that can move from animals to humans, be they polio, as a border county, coming from the border neighboring countries into our country. How will you manage at your own level? Be it those counties that have or are malaria prone, how will they be able to be ready to manage themselves to fight against malaria? It must be a partnership. Preparedness is not a national government function. It is a joint function of the government of the Republic of Kenya. And as I said earlier, the government is of 3 arms and 2 levels of government. But we are one government, and we must work together in order to ensure that our country is ready and prepared for any kind of disaster, be it a pandemic, be it terror, be it the health of our livestock, be it malaria.
So on Sunday you went for Yunta yesterday.
Thank you. I'm finishing if that's what your problem is.
Yeah. Which place are you going there?
Who am I talking to? Herbert Pa, somebody. Jamaza kidogo nimalize ile nasema. So like I'm saying, it is a responsibility that belongs to all of us. So I think the last thing that I wanted to say is that, as Governor Oparanya has said, and as I announced last week, we are intent on having a national conference where we shall review.
No, we were lucky as well, we saw.
And build upon the efforts that we have undertaken over the last 6 months. Where are we? How far have we come? And also use the opportunity to plan and to prepare Kenya's post-COVID action plan, which we hope to develop and work in close conjunction with all of you as we move forward. I just want to once again thank each and every one of you, thank the Council of Governors, thank all those who have been on the front line, thank all our partners, thank all our non-governmental organizations who have also partnered with us, and to say that we shall continue to work together, not only in combating and making sure that we defeat this virus, but also in building the Kenya that we want, a Kenya of shared prosperity, a Kenya that is open and transparent, a Kenya where her people enjoy her freedoms, her rights, and her liberties equally, regardless of where one comes from, regardless of one's gender, regardless of one's faith or color, that we are all children of one nation working together to build a great and prosperous nation for all. Thank you very much, Governor Oparanya. Thank you very much, governors. Thank you very much, partners. And with those few remarks, it is my great pleasure to finally declare this conference closed. Asanteni sana na Mungu awabariki nyote. Asanteni. Kwaheri ya kuonana.
Thank you very much. Before we disconnect, national anthem.